really felt like the focus of medicine wasn't in the right place. It wasn't in healing, it was in making money from surgeries and pills.
What's up, guys? Dr. Antonio Webb. I'm a board-certified orthopedic spine surgeon in San Antonio, Texas. And in this video, we're going to be reacting to a video that was put out by a neurosurgeon who recently became unemployed. He quit his job. I'm going to give my thoughts about some of the things that he stated during the video, about his reasons for quitting, a lot of the issues with our healthcare system, and just my overall thoughts as a spine surgeon reacting to this video. So we're going to jump right into it.
Hi, I'm Goobie. So I used to be a neurosurgeon. Went to college at MIT and did 4 years of medical school and 6 years of neurosurgery training. And I was a neurosurgeon for almost 10 years after all of that. So that's 20 years of my life. And I quit. And nobody understood why I quit.
There's been a lot of doctors that have recently quit. You know, since the COVID outbreak, there's been a lot of physicians who have left practice, and for a variety of different reasons. Being overworked, being burnt out, the stress, all the administrative burden of being in the healthcare field, declining reimbursements. So I'm seeing this over and over and over again. It's becoming a really common theme between physicians that are exiting medicine despite undergoing 10 plus years of training. It blows my mind, but it's happening.
People would ask, but a decision that involves 20 years of your life, you can't really answer in a couple minutes. And why someone's doing something that most people would never do, and they don't really understand why I would do that. So that's why I'm making this video. First, to help sort my own thoughts out about the whole thing, because there's a lot of factors, but also to maybe help somebody else who's in a tough spot.
And there are a lot of people that are in tough spots and they just don't know what to do. Some people are contemplating whether to leave medicine, whether to go into another field. I know a surgeon who recently cross-trained into radiology. So instead of being a spine surgeon, after going through all that training, he's going to be a radiologist. And he recently went back to residency to do that. So a lot of different things that are going on, and I'm seeing this over and over again.
So in my last year of residency, I learned how to do spine surgery, because that's what most neurosurgeons do. It's the most common thing. It's what a regular neurosurgery job is.
It's really interesting. Yeah, he said at his last year of residency, he learned how to do spine surgery. Most neurosurgeons, they get spine surgery training kind of early on throughout their residency, starting their first year and second year and third year. I found that really interesting. Even us as orthopedic surgeons, we start spine surgery training in our second year of residency.
I got my first job, and yeah, I knew that something was not right away.
A lot of people go into the workforce, so you finish all this training, residency, fellowship, medical school, and you get out into the practice, you start practicing medicine, and you realize it's not all as you thought it would be. There are a lot of different things that have changed. Maybe the healthcare field is constantly in an evolving field, and there are a lot of different things that can change. So when you start your training 10 years later, it could be a whole totally different workforce.
You know, I had good partners. I had good hospitals that I worked at, but something was not right. I was very unhappy. And on the surface, it didn't make sense. I was getting paid very well. It was a very well-respected job. I had good colleagues. I had good support. But I was the most unhappy that I've ever been.
Wow, I found that also pretty interesting that, you know, you have these ambitions and these desires to become like a neurosurgeon, a really prestigious and respectable field. And then you work your butt off getting to this point and you like, hey, I'm finally here. I'm gonna be a neurosurgeon. This is the greatest job ever. People would die for this job, and then you're unhappy. It is very common. A lot of people kind of report that because they don't know what they're getting into until they get into it.
Going back to medical school, when I took that oath and I had that older professor say that your job is to relieve suffering, you know, that's what I understood of what it means to be a good doctor. All the latest techniques, you know, I learned, and I learned how to do well. and I did them, and I helped a lot of people out. But there were way more people that I couldn't help.
I've seen that in my own practice. I see a lot of patients in my clinic, and some days seeing 30 to 50 patients in office, and vast majority of those patients don't need surgery, or a good percentage of those patients are not surgical candidates. They either have too many medical comorbidities, on blood thinners, smokers, overweight, uncontrolled diabetes, which would make for surgery be very complicated and have complications. So I didn't realize this until I got into practice, is that I can't help everyone. I mean, you come out with this altruistic mentality that you want to help people and get people better. You have all this training, you went to school for 10 to 12 years, and then you get out and you realize I just can't help everyone. And I remember specifically when I realized that into practice, and I started just telling myself that I can only do so much. There are only so many patients that I can help, and some patients I just can't help.
So what I was doing was I was doing the surgeries that I learned how to do. I was trying to help people, but these surgeries, they weren't fixing the problem. They would help some people feel better. Some people would feel the same. Some people would be worse. A lot of people I saw in clinic, I had to tell them that, oh, surgery is not going to help you. And of course they would be devastated because I was sort of their last hope.
I kind of disagree with that. I do think surgery does address those things. Those things happen: the arthritis, the bulging disc, the herniations, the slippage of the vertebrae. That's called a spondylolisthesis. Those things do happen. That those are age-related and wear and tear features of the spine. Everybody gets them as we get older. Surgery does address that. There's great surgeries, minimally invasive options. There's some open procedures that we can do to address that. But he is correct that it doesn't address the underlying issue. If a patient is overweight, let's say their BMI is 50, they're 290 pounds, they're uncontrolled diabetic, they have a lot of medical problems, well, maybe it's patient selection. Maybe that patient wasn't a great surgical indication or surgical candidate at first and didn't need surgery or should not have undergone surgery. Those are the patients that get poor outcomes. But if a surgery is well indicated, it's selected appropriately, patient has commensurate or appropriate pathology that correlates with their imaging studies, then I think those patients do really well with surgery.
I could do a perfect surgery and some people would get better. Some people would stay the same, some people would get worse, even though I did the exact same perfect surgery.
I agree. That's what I tell my patients. Surgery, it can make you better. For most patients, if you select the right patient and have the right pathology, the disease that we're trying to treat, it can help them get better. There are some patients that it can make your pain worse, and that's a risk of surgery, and that's something that I counsel every patient on before we undergo surgery. And there are some patients that don't get better with surgery, and that's out of my hands. I realized that early on in practice that I can't help everyone. If a patient has severe stenosis or tightening of their spinal cord, or if their spinal cord has been squeezed and tight for 12 years and they come to my office for surgery, well, that patient probably was a good surgical candidate 10 years ago or 11 years ago. But we're already behind the 8 ball. We're 10 years behind. This patient has severe nerve compression for the last 10 years. Whatever I do as a spine surgeon may or may not make that patient better. And that's the complex part that a lot of people don't talk about, is that if you delay certain things and if you wait, sometimes your symptoms can be irreversible. Whatever we do as spine surgeons may or may not make it better at that point.
The surgeries that I could do were like going into that house, tearing down that drywall, ripping out the moldy insulation, putting in brand new insulation, and rebuilding the wall, but not fixing the leak in the roof.
He's absolutely right. His analogy comparing the house to a patient that is 300 pounds, uncontrolled diabetes, has had 3 surgeries, You can do a really minimally invasive surgery or surgery to address a specific symptom, but if you don't correct the underlying issue, which is that patient's weight, their comorbidity, their conditions that they have, if they don't address that, they're going to be right back at surgery, and that's why they call it back surgery. Patients just keep coming back, and those are the patients that keep coming back.
People that got better were having a mostly plant-based diet. They weren't eating too much animal foods, and they were definitely not eating salty, and they would do things that would make them sweat, like exercise, being outside, hiking like this, going to a sauna, or they live in a warm place. They didn't smoke, they didn't drink much, they usually had a good social support, loved ones, family members, children, friends. They would sleep like 8 hours every day. And they weren't stressed out, or if they had a stressful job or something, they found a way to be mindful or meditate or just be present and release the stress back into the universe.
I agree. Your diet is one of the most important things. What you put in your mouth, is extremely important. Your body is a temple. I mean, America is notorious for having fast foods restaurants on every single corner, and it's killing us. There are a lot of patients that come in with uncontrolled hypertension, high blood pressure, uncontrolled diabetes, heart disease, kidney disease, issues with their back and with their joints, and it's all because of what we're eating. It's an inflammatory state. Arthritis is an inflammatory state. That's in your hips, your knees, your spine. So what we eat is extremely important. I think there's a lot of truth in what he said about plant-based diets and anti-inflammatory foods, because this can make situations worse. It can make your back worse, make your joints worse, make your atherosclerosis, which is hardening of your arteries, which can lead to blood pressure and heart issues. It's all interconnected. Your diet, extremely important.
Really felt like the focus of medicine wasn't in the right place. It wasn't in healing, it was in making money from surgeries and pills and images, whatever you can make money from.
No matter what you heard, no matter if people deny it all the time, medicine is a business. People are in medicine to make money. Yes, they're in it to help people and they have this giving or helping mentality, but hospitals, administrators, they're in it to make money, and it's a business. So if you're not making money, if you're not busy, if you're not seeing multiple loads of patients per day as an employed doctor, you will get canceled. They'll call you into the office and say, hey, Dr. Jones, you only saw 20 patients today. You need to see 30 patients now. Well, hey, administrator, I don't have enough time to see this many patients. I only have 15 minutes to see patients. Well, see them in 10 minutes. And that's what hospitals they're about. They're about making money. They're about profit. They're not really in the best interest of the patient. They're in it to make money. And same thing with insurance companies. They're in it to make money. You can pay all of this money for your insurance premiums and for your deductibles. And when you need to use your insurance, you can't, because the insurance is denying your surgery because you didn't go to physical therapy for 6 weeks, you went for 5 weeks. They think of every excuse that they can to deny your surgery, even though that you paid for years for the medical insurance, and they'll deny it in any reason that they can. The other thing is with the surgeon, after the surgery is completed, the insurance company is the last to pay the surgeon. So I did a surgery on a gentleman a year ago. I still haven't been paid. There are some surgeries that I did 6 months ago, and the insurance company still hasn't paid me. But if I don't pay my insurance premium, they'll cut my insurance. I can't use the insurance if I go to the hospital. Hey, I'm only 30 days late for my insurance, and I can't use it. But on the flip side, if the surgeon doesn't get paid for 9 months out of surgery, what do? Nothing. I just wait. Sucks.
My wife, I said earlier that she said, I see what you're going through. I've lived with you through it. You should just quit. And I said, what? How can I quit? You're not working yet. She was going to school for a second career, and she said, well, we'll be okay. We saved up some money. It's not enough to retire, but something to live off of for a few years.
One thing I took away from this video is that a lot of physicians, even though he's been a neurosurgeon for about 10 years, he noted that he wasn't set financially to retire just yet. That's one of the things that's really motivated me to just be financially savvy and also smart with my income, because I don't never want to be put in a position where I have to think about whether I can retire or not. And 2 years from now, or 3 years, 4 years, 5 years, if I wanted to quit working and not work at all, I want to be in a position where I can just walk away. If I'm this unhappy, gained 40 pounds, not happy with my job, my position, things are not going well, I want to be able to walk away. And that's one of my goals. And that's what I recommend for students, residents, attendings out there, is to make smart financial decisions that will allow you to have that freedom. And that's what I took away from this video.
I hope that you have a wonderful day if you're listening to this. And trust your heart. Trust your heart, lean on the people that love you, and do what you need to do, whatever that is.
Wow. So I think this video, there's a lot to unpack here. My overall thought of this video is that he found peace. He found his way out. I know a lot of people suffer and they go through years and years of turmoil and just depressed and burnt out, and they give up. They commit suicide. A lot of people don't talk about the suicide rates. They say that every day there's a physician that commits suicide. You just don't hear about it because of stuff like this. So what I take away from this video is that if you're unhappy, if you're having some issues, if you're just burnt out, if you're stressed out, you have to talk to someone. You also have to make sure that medicine is what you want to do, but it's hard because you don't know what medicine is going to be like until you're actually in the field, you're in practice, and you're there and you're working. And I've learned a lot about medicine that I had no idea, like the insurance issues, like the politics of medicine, the administrative burden, all the things behind the scenes that we have to do as surgeons that I didn't realize until I was in practice. So I think a lot of what he said was actually true about the issues, about not correcting the underlying issues with our weight, with our diet, our lifestyle, how inactive a lot of people are. If you don't correct those things, you can do a surgery and it not help a patient or cause more issues, or the patient's unhappy, which leads to another surgery. So the main things that I took away from this video are: make sure that you're active, that you watch your blood pressure, your heart rate, your diabetes, your cholesterol, you're eating healthy, you're walking, you're minimizing stress. All those things can exacerbate the other one. Stress can elevate your blood pressure. It can make your diabetes elevated, and your cortisol is released. It's a stress hormone that can raise your glucose. So all of those things have to be optimized. I think if you're unhappy, you have to just come to sit down with yourself and your support system, and just make sure that you make the best decision for you, because you can't help others and patients if you can't help yourself. And this is what I took away from this video. I think it was a cry for help from this neurosurgeon here. He's found peace, he's happy, he's doing things that he enjoys doing, and that's what life is all about. Just finding what your passion is and doing that. That's what I took away. Thank you guys for watching this reaction. There's a lot of people out there that are suffering, may not have an outlet, and you gave them hope. You just told them that there was a possibility. And a lot of people get really nervous about making a decision like this after going through so much training. And there's been multiple times along my journey in my practice that I was like, man, this is not it. I don't want to do this anymore. This is crazy. I'm working all these hours. I haven't seen my kids in a few days. It's stressful. This patient is trying to sue me. This patient had a bad outcome. But I think overall, you have to have an outlet to medicine. Make sure that you have a way to relieve stress, stay active, eat healthy, and just enjoy it. If this is something that you really want to do, medicine's a very rewarding career. It's not for everyone, but it can be very rewarding and life-changing for patients. Thank you for watching. We'll see you next time.